The Iowa Women's Foundation, through our research, learned that 70% of Iowa's female head of households were struggling economically. 70%. 40% were living below the federal poverty line, and another 30% were the working poor, or those women who were trying really, really hard to make ends meet, but for one reason or another, they just couldn't. We convened to the table stakeholders and we asked why. Why are women and girls struggling for economic self-sufficiency in your community? As a result of our community conversations and research, the Women's Foundation discovered that there were 6 barriers to economic success for women in our state: employment, childcare, housing, education and training, transportation, and mentorship. We looked at the research in more detail, and what we learned was that 1 in 2 children were going without access to quality, affordable childcare. There was a shortfall of almost 350,000 slots all across our state, and 24% of our communities were living in a childcare desert. The Women's Foundation, with its community partners, established the Building Community Childcare Solutions Collaborative. This collaborative is now a network of communities all across the state working together to identify the best possible, viable, doable solutions for their communities to increase the availability of quality, affordable childcare. Because childcare is a large issue, and the way to address it is going to be different from community to community, we created a toolkit that communities can use to identify the most viable, doable solution for them to move their work forward. In early 2020, the Iowa Women's Foundation was selected to participate in the Women's Funding Network Economic Mobility Project. Participating in the Women's Economic Mobility Hub enabled the foundation to expand our capacity and our engagement of communities all across the state, working to increase the availability of quality, affordable childcare. We have also been able to produce additional tools that the communities can use while they're working on their solutions. For example, we have a child care center in a box. We have an after-school program in a box. We have shared services. We have shared staffing. Really just different tools that have been identified that now can be used by all of the communities. The Building Community Childcare Solutions work started with our 8 original communities who identified childcare as a priority. We grew from there to 15, then we went to 30, and now as a part of the Mobility Hub, we are at 40. The Iowa Women's Foundation is honored to be a part of the Governor's Child Care Task Force. We believe the Governor chose the Iowa Women's Foundation to be a part of this task force because of our extensive work around the state and because we're seen as a leader who can get things done. We don't just want to put a Band-Aid on the symptoms. We really want to look at what's causing these issues and how can we address them so we don't have to deal with it again in the future.